Assalamu alaikum. Hello everybody. In this part, we will talk about the trachea and bronchial tree. As we know, they are one of the important parts of the respiratory tract. The trachea is characterized by its appearance of tracheal rings and the bronchial tree. We will see why we call it bronchial tree. So in this session, we'll talk about trachea, its anatomical features, its length, position, relations, divisions, nerve supply, blood supply, and the same we'll talk about the bronchial tree, their parts and the difference between the different segments. Okay, this is the trachea here, and it will start to divide into the bronchi and bronchioles. As we have seen in the previous lectures about the larynx will end at the level of the cricoid cartilage. Here, I'm putting this dotted line to stimulate you. And it ends at the level of the sternal angle of Lewis. And by doing so, the trachea divides into two main bronchi or two primary bronchi. Okay, so this is the beginning or the end of the trachea. So doing so, the trachea has cervical and thoracic part because it starts at the level of the cricoid cartilage at the level of C6 and it ends at the superior mediastinum, the lower part of the superior mediastinum, so it has cervical and thoracic parts. It is a fibrocartilaginous tube, has connective tissue, cartilage, hyaline cartilage. In average, it is about 10 centimeter. In average, it is about 10 centimeter, but it may differ from person to person. And it is almost in the midline, almost, not exactly at the midline, as we will see in the X-ray. So this is the trachea. These are the tracheal rings. This is the cricoid cartilage. And from here, we start the trachea. This is the part of the division of the trachea. And this, as we mentioned previously, it is at the level of the angle of Lewis. The trachea has 15 to 20 incomplete rings of cartilage. So they are not ring shaped, they are C shaped. And the part which is not completed by cartilage is completed by the trachealis muscle. And this is in relation to the esophagus posterior. So this is a cadaveric specimen for the trachea. This is the thoracic part. And here we have cervical part. And the tracheal rings are very prominent. And they are characteristic for the trachea. As we mentioned, they are 15 to 20. For the relations of the trachea, we have relations for the cervical part, and we have anterior relations, posterior relations, and lateral relations. The anterior relations are the isthmus of the thyroid gland here, you can see it here, which is related to the second, third, and fourth tracheal rings. And we have the inferior thyroid veins. We have the strap muscles, which cover this part. Posteriorly, we have the esophagus, as you can see it here, the recurrent laryngeal nerve. This nerve here on both sides, recurrent laryngeal and the esophagus. On the lateral side, we have the lobes of the thyroid gland and the common carotid artery. Okay, I hope this is clear. In the thorax, anteriorly, we have the sternum, the bone sternum, the thymus gland, which is prominent in children, the left and the left brachiocephalic vein, which cross from the right to the left, and the brachiocephalic artery, the left common carotid artery, and arch of the aorta, which is related to the last part of the trachea. Posteriorly, the esophagus continue to be there, and the left recurrent laryngeal nerve. On the left side, we have the arch of the aorta, the left common carotid artery, the left subclavian, the left vagus, the left phrenic nerve, and the pleura. On the right side, we have the azygos, the right vagus, and the nerve and the pleura. Okay, so this on the lateral side, this is anterior, and this is posterior relations of the trachea. You can see that the trachea has very important relations in the neck. This is the thyroid gland, the isthmus, and the lobes. Both are related. This is the common carotid artery. This is the left brachiocephalic vein. You can see it here. This is the arch of the aorta. And on the right side, this is the brachiocephalic vein before dividing. Okay, so this is a very nice cadaveric specimen which uh, we see in which we see the relations. Okay, another picture for the relation: the brachiocephalic, the common carotid, the brachiocephalic artery, the recurrent laryngeal nerve on the right and the left here, and posteriorly we have the esophagus. The trachea is supplied by branches of the vagus and the recurrent laryngeal nerve, and we have branches from the sympathetic trunk. We have arteries from the arterial supply from the inferior thyroid and the bronchial arteries, and we have lymphatic drainage to the pre and paratracheal lymph nodes, pretracheal and paratracheal lymph nodes. It is very important to identify the trachea in an X-ray. This is an X-ray. You can see here black column of air. This is the trachea. It is almost at the center here. So this is the trachea. You can define it here with these blue lines. It's very important because sometimes some diseases they push the trachea to the right or to the left. Some clinical points about the trachea. We have tracheostomy. Tracheostomy is opening the trachea and putting a tube, and this is usually done in emergency conditions when there is closure and obstruction of the upper airway, and we need to save the patient by inserting a tube in the trachea. So there is problem in the upper respiratory tract, and the patient will only breathe through this. Okay, so this is a tube and it is passing through the trachea. Just we need to know this name, tracheostomy. This is another patient with tracheostomy. Okay, next let us talk about the bronchial tree. The bronchial tree start with main bronchi. They are big. Then we go to lower bronchi and segmental bronchi. Then we go to smaller bronchioles, but there are so many divisions of bronchioles. So these are the main bronchi. Sometimes we call them primary bronchi, lobar bronchi or secondary bronchi, segmental bronchi, or tertiary bronchi. Here we have two main bronchi, lobar bronchi according to the lung. The right lung has three lobes, so we have three lobar bronchi. At the left we have two lobes, so we have two lobar bronchi. Segmental bronchi, in each lung we have 10 segments, so each of the lobar will divide into 10 segmental bronchi. Okay, so within the lung, each bronchus divided into a number of branches that can be divided into two groups. We have conductive zone, primary, secondary, tertiary, then smaller bronchi and bronchioles, terminal bronchioles. At the respiratory zone, we have the respiratory bronchioles. So it look like a tree because the division of the branches are so many types. This is trachea. It divides into main bronchi or primary bronchi. The primary bronchi divide into lobar bronchi. You can see them here and here. We have two lobes on the left. Then segmental bronchi 1, 2, 3, up to 10. Then this segmental bronchi will divide into bronchioles. Okay, so the bronchial or the bronchiolar tree here and the different branches. What are the number of bronchopulmonary segments? They are 10 segments, and then we have 10 uh, segmental bronchi. And these bronchopulmonary segments, they are very important because sometimes they, if we want to remove part of the lung which is having a disease, we can just remove this part which is bronchus and its branches of the pulmonary artery and vein. Okay, this is the two lungs. We have branches from the pulmonary artery, pulmonary vein, and from the trachea. The bronchial tree is supplied by the bronchial arteries, which come from the aorta. If this the descending aorta, we have branches which go to the bronchial tree, and we have veins which uh, go to the systemic circulation. Again, if you have any questions, you can just post them to the channel and I will be happy to answer them. So we talked about the trachea, its cervical part, thoracic part, where it starts, where it ends, its important relations. We talked about the divisions of the bronchial tree into primary bronchi, secondary bronchi, tertiary bronchi, then bronchioles, which end as terminal bronchioles and respiratory bronchioles. Then we start the alveolar part. Thank you very much.